Hi all, myself Dr. R. Rajakrishnan, an assistant professor from SNS College of Physiotherapy. In last two videos, we have saw about what is stroke, what are the types of stroke, what are the causes of stroke, what are the clinical basis of the stroke, and how the stroke transforms, what is the pathology of the stroke. In this video, we are going to see about what should we do when the person is having stroke, or what should we, how can we assess that it is the stroke. A spot, a spot test for the stroke. Be fast. Like balance. Be fast. It's an abbreviation for B for balance, E for eyes, F for face, A for arm, S for speech, T for time. Like this, in this picture, it's clearly shown that if the patient is having a balance imbalance, it's maybe because of stroke. If the patient is having getting up from the bed and is having the balance imbalance, so it may be because of the stroke. The eyes is going for nystagmus. We already saw in clinical feature. It may be a stroke. The face is having a drooling or facial weakness over there. It may be the stroke. The arm is getting weak and the patient is complaining he can't able to lift his arm. Then it may be because of the stroke. If it is because of the speech is impaired, the speech is slurred, it may be because of the stroke. On time, we have to call the ambulance. On time, we have to get for a medical advice. So it may safeguard the patient's life. So these are the important things we should do when the patient is having the stroke. When we can confirm this, if the patient is having, so all these facts are the confirmation of the stroke. Then the next, how we investigate if it's the stroke. First, we have to go for a physical examination. Then we go for first in 1 or 2 hours. We should go for the any kind of injections to dissolve the emboli if it is because of the thrombus or emboli, or maybe for the angioplasty. For first 2 hours, it is the very golden hours for the stroke patients, neurological stroke patients. We have to do investigations for blood pressure, continuous monitoring of the systolic and diastolic blood pressure. And maybe it is because of the hemorrhagic stroke. Then we should go for a CT scan or we should go for MRI. It clearly shows which part of the brain affected because of the stroke. Then we go for the cerebral angiogram. A small incision, usually in our groin, or that guides the wire through the carotid artery and vertebral artery. If a thin catheter is inside, then it shows that where the block is getting affected. Then the carotid ultrasound, then the echocardiogram. If the if the source is from the heart. Then the management, like how we manage with the pharmaceutical management is we go for antiplatelet therapy, then we go for aspirin 300 milligram per day per kg. Then the anticoagulant like heparin, warfarin. Then for lipidemia drugs, atorvastatin, rosuvastatin, AC inhibitors, beta blockers, calcium channel blockers will help in the decrease of the blood pressure. We have the hypertension. Then it goes for the surgeries. We can go for the surgical clipping. Surgeon places a tiny clamp at the base of the aneurysm to stop blood flow to it. We can prevent the bursting and we can stop the bleeding. Coiling method is there. The catheter is inserted into an artery in the groin to a thigh region and it guided to the brain. Our surgeon will place the detachable coils into the aneurysm to fill it. Then if we go for this is the picture shows that the collapsed aneurysm and the clipping method, they will cut the artery, they will clip the artery, so the aneurysm won't be get collapsed or it won't go for the any other blood vessels in the brain. See this is the coiling method. The wire is guided there and it is filled there, so the blood flow will be getting normal. Surgical AVM. To remove small AVM, it's located in an accessible area of the brain. It eliminates the risk of the rupture, lowers the risk of the hemorrhagic stroke. And another method is stereotactic radiosurgery. Multiple beams of highly focused radiation is an advanced, minimally invasive treatment used to repair blood vessel malformations. And we should go for the physiotherapy management as well as the surgical management if it is needed. But we should do the regular checkups to the neurosurgeons or neurologist regularly to avoid the next recurrent stroke. So this is all for the stroke in the clinical part. Thank you.